Dr. Shazly, welcome and thank you for joining.
Well, thank you for having me.
Yeah, well, this is what's fun about doing these is I get a chance to talk to people I don't see so often. You're mostly spending your time at St. Margaret's clinically and servicing and helping people in that community, but and your fields are certainly of great interest to many people. What you're studying, and or what you're treating people in glaucoma and in neuroophthalmology. So all that training, it was a lot of training. So at some point, growing up through school or you got inspired to get into medicine, and obviously in a really big way. What inspired you to do all this?
It's a tough question. I don't think there was a one particular point of time where that decision has been made. I grew up interested in disassembling and reassembling things, coming up with new contraptions and stuff like that. So I always thought that I would be more into engineering than medicine. And at some point, as my parents really wanted me to be a physician growing up, they had a very good sell, which is if you want to study both, do both, there is a chance to do that. And there are some fields of medicine that would benefit from like some sort of engineering background. And it's like, okay, I'll start with engineering. And their selling point was that it's relatively possible and plausible to get an engineering degree like online or something like that. You can study courses and stuff. That's very, very difficult to achieve in medicine.
Yeah.
Now, at this point, I don't think that is extremely accurate, but I bought it and I got into medicine. And I think fixing people's problems was definitely worth it. I got more and more interested in medicine, medical school, and at some point, ophthalmology, the eye, caught my attention. It's a very unique structure, living miracle, basically, that means a lot to people, and they rely on it for their functionality. And at that point, I got interested in ophthalmology like midway through medical school.
And your particular focus, in glaucoma and neuro-ophthalmology. Tell us, a little bit about some of maybe the patients that you treat or the things that are very interesting to you clinically, but also even, academically, maybe, since you've done so much school and what you enjoy either training or getting involved with in various research projects and so forth.
Got it. So early on, I realized in medicine that one of the challenges that we have as healthcare providers, as researchers, that medicine expanded so much that there is a lot of overlap, and there are some uncharted zones between different subspecialties. For example, what I currently treat, optic nerve disorders, is kind of a common land between the area of glaucoma, which is focused on the optic nerve, and some other medical conditions like optic nerve disorders and glaucoma mimickers, which belongs to the neuroophthalmology subspecialty. And as I did my glaucoma training, I realized that that area of overlap is larger than what I originally thought. And I decided to get into some sort of neuroophthalmology training after I finished my glaucoma specialty. So after I finished my glaucoma training at Mass Eye and Ear, I decided to apply for neuroophthalmology, and this is how I landed in Pittsburgh. So I end up treating a lot of patients with normal tension glaucoma, a very special entity in glaucoma that has, again, a lot of overlap with some other optic nerve disorders and optic nerve blood flow issues. And it can be mimicked by a number of life-threatening and sight-threatening conditions that might look like glaucoma, but they are not. During my glaucoma training, I started my research that was focused on selective laser trabeculoplasty technology, since my mentor in fellowship was the inventor of selective laser trabeculoplasty. So I ended up getting interested in its predictors of success and its application in different kinds of glaucoma.
Wow. Yeah, that's, I know it's, the glaucoma is often associated or linked to the intraocular pressure being high, but we still have a lot of people with normal pressure glaucoma that still unfortunately develop the optic nerve damage. So that's a target for the kind of person that you see and are specialized to see specifically.
Right.
That's that.
And there's a lot
So,
of we learned
yeah.
from neuroophthalmology in the field of glaucoma, even in the non-normal tension glaucoma area. For example, we know that some people with glaucoma can have a slightly higher than normal pressure, and they get kind of quick decline in their optic
Mm.
nerve health, while others can have much higher pressure and they sustain their optic nerve health for years. And we see similar, examples of that in, for example, elevated intracranial pressure patients in neuroophthalmology. So there's
Interesting.
a lot to be learned about neuroprotection, for example, from neuroophthalmology. So I
Well,
think the two fields was very useful to my
that's
patient population.
that's fascinating. So now you've already, I mean, you've done a lot of education, a lot of training, and obviously you've treated many patients and helped a lot of people. If you were to identify one major thing, we won't limit it to just one thing, maybe one major area that or focus that you're just most proud of in terms of your professional accomplishments, what would you say that is?
Sure. I mean, I'm still hopeful that it's early enough in my career.
Hasn't happened yet.
It hasn't happened yet. But I think what I'm particularly proud of at this point is that I was able to recognize as part of a team a number of predictors of success of selective laser trabeculoplasty. It's a technique that we do quite often in the office, and it's considered one of the first lines of treatment for glaucoma. So it's widely practiced. But one of the mysteries of it is when is it going to be effective and when it's not. And I was able to recognize certain predictors like the corneal thickness, the baseline intraocular pressure, the presence of certain eye conditions like pseudoexfoliation, things like prior cataract surgery and so on. So I think those improved our ability as a glaucoma community to better select our patients to get that procedure done. On the other hand, on my neuroophthalmology side, I was able to use and utilize OCT, a very common diagnostic modality, in predicting the outcome of patients who are undergoing pituitary gland tumor resection.
Oh,
Yeah,
okay.
so using a very simple bedside test or office-based test, you can predict how much vision will return after something like a surgical decompression, something that is very vital to counseling the patient before such invasive surgical procedures.
Oh, that's really impressive. Now, you made a decision to come in 2013 to the University of Pittsburgh and to Pittsburgh, and you came from some pretty impressive places. And what made you decide that this is a good place to do training and then eventually to stay? What were the factors there?
Sure. So I have a kind of confession to make. When I came into the United States back in 2008, I spent most of my time, my clinical glaucoma fellowship, my internship in Massachusetts. And I,
Uh-huh.
not growing up in the States, I didn't really knew much about the rest of the country. And even though I've recognized certain, big names like University of Pittsburgh, yet I didn't really know much more than
Sure.
the goodwill of the name before coming over. And as I was interviewing for my neuroophthalmology fellowship training, I had this chat with my surgical mentor in my internship. And I said, I'm applying for neuroophthalmology. And he was very interested in that field as a medical student before becoming a vascular surgeon. And he had some bit of advice to me. And when he asked me where I'm interviewing, I started mentioning the places, and I mentioned University of Pittsburgh. And he stopped me. He's like, "You got interviewed at University of Pittsburgh?" It's like, "Yeah." It's like, "And are you thinking about it?" It's like, "Yeah." I'm like comparing places. Like, just go there. It's like, yes. And I was surprised, having that piece of advice from somebody who's outside technically in my field. I was in ophthalmology for like 15 years at that time, but he knew so much and he knew very well, or way more than I knew. And this is how I actually got accepted in my neuroophthalmology fellowship here. And just starting, I got to know the program much better, and I worked with the different faculty members in different
Mhm.
divisions. And I got to see how, the department is generating cutting edge research, taking care of patients from all over the world.
Mhm.
And from there, I got into residency in ophthalmology, my second residency in ophthalmology in
Mhm.
Pittsburgh. And When I was offered a position in the department, I didn't even think twice. This is a great place to be.
Well, I'm glad you did. There's a lot changing here, and we're seeing a lot of new people coming and a lot of growth and tell us a little bit about, from your perspective, how that can make things very exciting for you, and some things you may be looking forward to.
Sure. So I think the Department of Ophthalmology in University of Pittsburgh has already achieved a lot, but it's also expanded and is expanding pretty quickly. It's one of the few departments in the country where you see the clinical and research faculty working together, generating both clinical and basic research. And we're very hopeful with the new building that we'll have those connections even like getting tighter and
Hmm.
generating more prolific. Um, but one of the other things that I have seen is, again, the diversity in the department.
Hmm.
I have been trained in some departments in the US and outside the US where most of the faculty have been trained in the same institution, which is good. It actually is helpful, generating more friendly, familial kind of connections. But it's always good to have people who trained in different institutions, having different backgrounds, different blends of subspecialties, because that really enriches the scientific environment and improves patient care, providing more, diverse, again, profiles of treating patients and doing research.
Well, yeah, thank you. That's a perspective actually I didn't hear much from some of the other. I mean, obviously we are very much that, but I didn't realize, that not every institution is that way, because I have always been here. But we certainly do. We have people from all over the world, really, in terms of their training and even where they have practiced in recent times. Well, wonderful. Again, I appreciate these opportunities to get a chance to do this and to get a chance to meet some of the faculty and talk to some of the faculty that I haven't talked to as much. And I don't get to see you very often, but it's nice to see you today. And thank you for taking time to do this with us.
Thank you very much. Appreciate it.
Okay, have a good day.